Hello and welcome. My name is Raj Persaud and I'm a consultant psychiatrist based in private practice in London, in the United Kingdom. And I'm delighted to be joined today by Wesley Turner and Leanne Casey from Griffith University, the Griffith Health Institute at Griffith University in Brisbane, in Australia. And Wesley Turner and Leanne Casey are co-authors of a very recently published paper entitled Outcomes Associated with Virtual Reality in Psychological Interventions. Where are we now? And this is published in a very prestigious academic journal entitled Clinical Psychology Review. So before we get into the actual paper itself and its results, I want to start by asking you both, what is a virtual reality in a psychological intervention? What is a virtual reality treatment?
Well, I suppose one of the interesting things about virtual reality of late is that there's been a massive change in what that looks like. If people at home listening to this might be thinking about virtual reality, they might be thinking of things from the late 80s or the early 90s about those huge helmets and head-mounted displays and whatnot.
And with those head-mounted large displays, really the object is to present a computer-generated version of reality. And that's at the heart of what virtual reality is. It's a computer-generated reality. But as Wes is going to describe, we've become a lot more sophisticated in how that can be presented.
Yeah, so some of the examples that we have are, I think, the Oculus Rift, which is quite common and quite new nowadays, which is a very small kind of head-mounted display. But it can also encompass things like the Nintendo Wii or the Xbox 360 Kinect and other kind of motion capture devices, which also bring people into that 3D environment and make them part of it. I suppose that's what virtual reality looks like.
And one of the points about virtual reality is meant to create what I think is referred to as an immersive environment. In other words, people kind of get lost in this environment and feel, to some extent, that they are in a real environment. Is that right?
Yes, that's right. In fact, it's an incredibly strong experience when one first tries the virtual reality. One of my very favourite pictures that's emerged from this whole movement is a picture of a very elderly lady in about 80s and 90s putting on an Oculus Rift for the very first time, and the wonderful expression of amazement and awe as she literally sees this complete environment. And when one is experiencing virtual reality by simply strapping on one of these devices that Wes has been describing, it literally is like being in an environment.
Yeah, being there at the time and being brought into it.
I guess another way to think about it is, we have become very accustomed to 2D images. We see it on TV when we go to the movies. But once you bring in the technology that enables the virtual reality experience, it is, if you like, stepping through the screen, through your TV screen and being part of that environment.
Now, most of us can understand why virtual reality might be an appealing thing to do with gaming or maybe watching a movie. It's a bit more surprising to think of it being used in treatment for psychological disorders. Why that link? Why would people think about using virtual reality as an opportunity for delivering psychological treatments?
One of the most effective forms of psychological treatment involves what we call exposure. That is, exposing people to particular environments where they get to experience being in the presence of, for example, something that they fear, or get to participate in a situation which gives them a chance to practice certain skills. And we've known for quite some time that that experience is immensely powerful, and really it's at the heart of, for example, the very successful treatments that we've developed for the range of anxiety disorders, I guess is the example that comes most quickly to mind. And so what virtual reality really enables us to do is to immensely fine-tune that experience for people. If you think about where some of the exposure treatment started, so for example, Walpay's systematic desensitisation, a lot of that was depending on the patient being able to close their eyes and get an image. In virtual reality approaches, the patient is no longer having to rely on their own capacity to generate an image, nor is the therapist having to rely on the patient generating the appropriate image. Instead, that image making is comes under the control of the therapist in a way that enables much more fine-tuned approaches to treating some of these problems. So, for example,
sorry,
so
go ahead.
For example, somebody who's very fearful of spiders. Now, that used to treat that one used to have to first up depend on whether the patient could generate an image of a spider, or depend on how successful the therapist was on capturing some spiders for the patient. With virtual reality, we can call up those images, but importantly also add an element of control, so that we know another very important part of exposure-based approaches is making sure that the patient remains with a sense of control in the situation. And virtual reality also assists us in that way. So, for example, being able to zoom in closer to the object or zoom out, see different aspects of the image.
From what I've seen, and I saw a very primitive program a long time ago, to me, and I'm not an expert in this, the fact that you can expose people to spiders, let's say, through virtual reality is less interesting than another, perhaps even common affair, which is a social phobia, or often manifested as a public speaking fear. I've seen a very primitive program where people were in an immersive environment where it looked like they were giving a talk, but the environment created an audience that was incredibly negative and bored by your talk.
Yes.
You could even hear
Yes.
audience members saying things like, "Oh my God, this is really boring." And that,
Yes.
I thought, was a really impressive application, because that's more difficult to recreate in a therapeutic environment than confrontation with a spider. I wanted you to say something about that.
Yeah, look, you're absolutely right that one of the advantages of virtual reality is that it allows you to create situations that would be otherwise very, very difficult, if not impossible. One can, as a therapist, go and collect some spiders, particularly if you happen to live in Australia, where we have all sorts of things running around. But it can be harder to recreate situations, and particularly with social anxiety, where often what people fear actually doesn't occur naturally in the normal environment. It's not often that people, for example, attend a talk and start catcalling or whatever. Fortunately, that's not very common at all. But in virtual reality, we can create that experience so that people actually confront what it is that they fear. And you're right. So, with social anxiety, it's a good example of where virtual reality allows us to go beyond what is possible, or what is easily possible in current exposure approaches.
Another crucial thing it seems to me that you're able to do with this technology is the time of exposure. Because over and over again, in my view, people who are doing exposure therapy but don't really understand how it works and are doing it badly, create an exposure situation, but take the object that the person's frightened of away too quickly, or the person themselves retreats from the object too quickly. They reach a high state of anxiety and then they leave at that moment. When, as I understand it, you're really meant to stay for much longer. So you experience the anxiety descending, if not coming down to a very low score. And that bit is often got wrong, and virtual reality presents an opportunity to get that timing bit right.
Absolutely, and it's the crux there is about what I was saying before about the importance of people maintaining a sense of control in the situation. So a very famous experiment that was done in the 80s gave people what was actually an illusion that they could reduce the intensity of an exposure to some gas that was creating some physiological sensations. And what they found was that people who had that sense of control were actually better able to remain in the situation. And so that's been a very important understanding in treatment of using exposure approaches.
Okay, so let's now come to your review. Your review was an attempt to look at all the research that had been done on the effectiveness of this new treatment and see how effective it was proven to be. Could you say something about the kinds of studies you found and the kind of treatments and what your results were?
Yeah, absolutely. So one of the things that we found before we started this study was that there has been some systematic reviews or meta-analyses on virtual reality is already done, but it's very much on that exposure point of view. How well do exposure virtual reality treatments work? So we tried to just broaden it a bit to see what other treatments might be out there. And some of the other ones that we found were things like pain management, which was using distraction. One that came up quite often is, as it's been mentioned a couple of times, skills training. So skills training for people with intellectual impairments, developmental disabilities, schizophrenia, other situations like that. And something else that came up quite a bit was occupational and kind of, I guess, that therapeutic therapy or physical therapy for things like cerebral palsy, multiple sclerosis, and strokes, a lot of rehabilitation kind of things.
And
so what we...
Sorry, go on.
And so what we were really trying to do was to take a broad view of this field. There's been, in a sense, a lot of initial excitement when virtual reality approaches first emerged. And it seemed to us that this is quite a critical time, because one of the drawbacks of the original virtual reality research was that it was, as Wes was saying before, being done only with immense amounts of laboratory gear and in very specialised centres.
Yeah, they're expensive and very cumbersome.
Whereas with the developments that are occurring so rapidly at the moment with the development of these new technologies, we really feel that this field is poised for a next big step. So with the Oculus Rift that Wes was describing before, our understanding is that that will sell for around about $300-400, which is, I'm not too sure of the conversion rates, but probably about £200 or something like that. There's even been the creation of a cardboard cutout that one can attach to one's smartphone, which I think sells for about $20 or $30, so about £10-15, that will enable people to get some sense of that virtual reality. So really, we're at the point where we can see a great deal of expansion in this area. And so what we wanted to do was to understand what the evidence is telling us. And one can really only do that by going beyond the individual studies and surveying the field more generally, looking at the evidence base.
And what did you find? What, roughly speaking, were your results?
Well, the good thing is that overall it seems to be quite effective. There was several RCTs done, or randomized controlled trials, that we looked at, and for the large part, when compared to things like waitlist or non-intervention, so just having people who are not getting treatment, it was quite effective, which was, I suppose, what you'd want to see to make sure it is actually an effective treatment. But when compared to other forms of treatment, and that would be things such as cognitive behavioral therapy or just general skills training, which would be done in, say, small groups or face-to-face, it was about on par with the virtual reality treatment. So we did find, I guess, they were comparable, which I suppose talks a little bit about what virtual reality can be used for and that it might not be a replacement as such, but a different method that people can use in situations that it might not be appropriate or adequate enough to actually do face-to-face treatment or group treatment.
Was there any pattern that emerged in terms of particular treatments or particular disorders where it looked like virtual reality was particularly promising?
I suppose exposure is the common one that comes up, and it's got a nice track record now of showing evidence for its efficacy. A couple of the fields that came up just with my own investigations, which I found quite interesting, was pain management. It seemed to be quite good in treating pain, whether it was from cold presses or people suffering from cancer or other problems. And a lot of the skills training programs seemed quite promising and quite interesting in that, as we were discussing before with the treatment for social anxiety, being able to show the faces that in a crowd that you wouldn't really be able to get normally, they were able to put people in situations that they'd either be not ready for or uncomfortable to be in. So an example would be some people with intellectual impairments learning how to go down to the shops and just buy a couple of groceries and whatnot in a way that's going to be a lot less scary for them, in a way that they can work through each step and get confident and comfortable with it before they move on. So I think something like that is an area that you might see a lot of promise in.
Because the other thing that came out of our review was we very purposely selected studies according to some fairly strict criteria, essentially as to whether they displayed sufficient scientific rigour. In other words, that they compared their study to another condition. And using that criteria, we identified only 30 studies.
30 odd, yeah.
Yeah, 30 odd studies that meet that criteria at this point, which I think says a lot about the stage that we're at within this field. And again, we anticipate that will expand dramatically with the availability of these new technologies.
Is it possible, and I know this is maybe an unfair question you may not be able to answer, but is it possible to say something about the areas where the studies were very disappointing? In other words, where virtual reality was not looking like a particularly useful approach, or the areas where it seemed to be least helpful, least effective?
Yeah, look, I'm not sure that we could reliably say at this point where it is less effective, again because of just how new this field is, and I guess I feel a little bit wary about making comment on that when we don't have the evidence. I think the way forward has to be looking at the evidence, and okay. I don't think we have a clear understanding of that question at this point.
Okay, would you be able to say something about where you think the future is? Do you think, for example, at one extreme it's possible that therapists should become a bit anxious about virtual reality and that they're all going to be replaced by virtual reality machines at some point in the future?
No, look, I've been a clinical psychologist for nearly 30 years now, and I anticipate I will have no difficulty remaining employed. In fact, what we see with this broad range of technologies being included. So, for example, you'll be aware, and your listeners will be aware, that we've seen the development of web-based therapies. What we see instead is that the availability of treatments actually enables more people to get treatment, because our fundamental problem in mental health is the vast extent of unmet need. And so I think there is no need whatsoever for psychologists, psychiatrists, mental health clinicians to be at all anxious about any of the new technologies. Instead, I think what it's going to give us is
more options.
More options, exactly.
Yeah, and I think that's one of the take-home messages from our study, but also I think virtual reality interventions and technological interventions and treatment in general, and that it's not going to replace any other treatment modality like face-to-face treatments and whatnot, simply because it comes down to individual preferences. There are people who love the idea of being able to go on their computer and use that to be able to get help. But those are people who probably wouldn't come into face-to-face treatment anyway. They either wouldn't see a GP or they wouldn't see a psychologist or a psychiatrist. Whereas those who are coming anyway or are more interested in getting that face-to-face one-on-one contact, it's probably not as interesting or as enticing to them to actually go down the more technological or virtual reality route.
In fact, one of the areas that I've been working with one of my other PhD students has been at this idea of using technologies as an adjunct to our traditional therapies. So we've been doing some work making use of an app to assist people to complete homework. And I think there's a whole range of technologies which we can incorporate into our existing approaches and hopefully to enhance them. Because I think in addition to that unmet need that I was discussing before, we also have a situation where we know our, if you like, best therapies at this point simply don't reach everyone. They simply don't, they're not the cure-all. So I think we always have to be looking for ways to enhance our treatments.
So, Wesley Turner and Leanne Casey, we're running out of time a little bit, and to close, I'm going to ask you again maybe an unfair question, but I wondered if either of you or both of you have actually used these virtual reality machines, and whether what kind of impact it had on you. Did it change something within you? Did you find you got better at something, or what was the personal psychological impact of trying these treatments out? Would you recommend them to anyone who had, and would you try it out yourself if you developed the problem that you treat them?
My own experience to date has been experiencing it and at the same time an immense sense of excitement, and certainly I would be prepared to try it. I think Wes, though, has had some interesting experiences.
Yeah, I haven't had proper experience with the traditional sense of using virtual reality treatment, but what did get me interested in the field to begin with was some exposure playing video games. I'm not quite comfortable with heights myself, a bit of agoraphobia. And what happened was I fell in this game from quite a great height, and I actually felt a bit of an anxiety response coming up from that. And I realized at that point that what was happening was, again, as you mentioned earlier, I was immersed in a game to the point that I was actually feeling the sensations of my character in the game. So I've had a little bit of that, and I've had some experience, I suppose, giving myself exposure to falling in heights in those games, and I've actually found myself becoming a bit more comfortable with heights as a result. So I think it's quite effective even in the small little bits like that, so something definitely worth looking at. And I would definitely recommend it.
So did you, before this experience, did you avoid heights in real life, and did it change your avoidance afterwards?
It did, actually. I avoided them like the plague, to be honest. I would not get close to cliff faces or railings and balconies and whatnot. I'm a lot more comfortable with them now.
Okay, wow, well, there's a personal endorsement there. So, thank you very much indeed, Wesley Turner and Leanne Casey. They're both psychologists at the Griffith Health Institute, Griffith University in Brisbane, and the title of their study of their paper is entitled Outcomes Associated with Virtual Reality and Psychological Interventions, Where Are We Now? And it's published in Clinical Psychology Review. Wesley and Leanne, thank you both very much indeed.
Thank you very much.
Thank you.